Hello, so I'm open to Module 5 again in week 3. And in Module 5, we will be covering Chapter 6, which is health-related behavior and health promotion. So we have a good basis now for understanding stress, for understanding what is health psychology and how do we approach health as psychologists. And now we're going to dive a little deeper into some of the behaviors related to health. And you're already starting to see some of this in the longevity book. Obviously, we've been talking a lot about personality and its relationship to health, but you see a lot of the health behaviors of the termites, and you're starting to see patterns of how that's shaping them and how some of them are faring, in terms of their health behaviors. But here's where we dive in a little bit deeper to specific types of behaviors. So we'll also be covering Chapter 6 of the Longevity Project in this module, and that has to do with childhood and schooling. So we'll take a look at that in a minute. But your objectives for Chapter 6 are looking at health behaviors, what is well behavior versus symptom-based behavior, and sick role behavior. These are all different types of things we do when we are well and when we are ill. So you want to be able to distinguish between those. Also, how health behaviors differ in individuals due to demographic variables. So depending upon where you live, what kind of job you have, how much education you have, you're going to differ in how you do or do not take care of yourself. What kinds of things you choose to engage in that may be health risks or health compromising or health promoting. We'll also look at some various measures that are taken to prevent disease and improve treatment. Such a big focus now finally on prevention of disease. We've been very much a Band-Aid society for a very long time, which basically means waiting until people get ill and then trying to treat it. If we could do a better job at promoting health, teaching people how to make wise, healthy choices, how to eat well, how to exercise, how to find patterns of health behavior that work for you, how to avoid health risk behaviors, then we're going to go a long way in making people healthier overall, experience more overall well-being, and live longer lives. So that's the key there in prevention. We're also going to take a look at primary, secondary, and tertiary types of prevention, and understanding what each of those are and what some examples would be for each of those. And then the overall promotion of wellness. It's very tough in the health world. I mean, not only for doctors, but just people who are, health advocates who are in the health field, trying to get people to take good care of themselves. There's so many different factors that come into play when you're trying to promote the health of individuals. And some of those factors are things about the individual, their age, their gender, their demographic variables, and some of those things are interpersonal, who they're around, what their community's like, what kind of social support they have or lack thereof, who they're interacting with. So we'll take a lot of time to talk about how learning plays a huge role in health-related behaviors. So things like operant conditioning, classical conditioning, and modeling are all types of ways that we learn behaviors. We learn how to do all sorts of things throughout our life, like tie our shoes, or do a good job in school, or play the piano, or take care of ourselves, make our bed in the morning, brush our teeth. All of these things are reinforced maybe through our parents, through our teachers, coaches. And so these types of conditioning play a big role. What kinds of health behaviors have been reinforced by our parents and teachers? What kinds haven't? How have we modeled poor behaviors after our parents or our siblings or others. And so we'll take a look at how we learn these types of behaviors. And of course, we'll be looking more at the role of personality in health behaviors, as well as some different cognitive factors that impact health-related behaviors. And then we'll get into a few models of health. And these models are really used to guide people's understanding, health professionals' understanding of why people do what they do. So we have the health belief model, the theory of planned behavior, and the stages of change model, also known as the trans-theoretical model. And these are just different models for understanding why people do what they do when it comes to their health. Why do people who know smoking's bad continue to smoke? How could you get someone to stop smoking if their health is at risk? What would work, right? That's the golden question, especially for doctors. You know, you're seeing a patient who's struggling to breathe, can't walk up a flight of stairs, and is really at risk for cancer, yet they won't stop smoking. What would you do, right, as a healthcare provider? How would you motivate that patient, perhaps? And if we understand how people think about their behaviors, we can get a better sense of then how to attack that behavior, how to put into action something that's going to be relevant and doable for the patient in terms of changing any poor behaviors that they have. So we'll also look at motivational factors, because that's a huge impact on what people choose to do is their motivation. You know, how motivated might people be to exercise or eat healthy, and how can things like false hope and different emotional factors come into play when dealing with those motivational issues. We'll look at some different stages of development and how health behaviors change depending upon your developmental stage. So we'll go all the way through from infancy to aging and sort of what we look at those different time periods, which is really cool because we're already seeing a lot of that in the Terman data, right? With the Longevity Project, we're seeing what these folks were like when they were younger, what they're like when they're older. So this will be a really cool chapter to tie into this discussion post that goes along with chapter 6. We'll also look at some sociocultural factors in health, such as social class and diverse populations. What are some factors that people encounter given, their ethnicity, given what their income is, where they live, what kinds of neighborhoods they're in, how does this affect the choices that they are or are not able to make, what kinds of factors are in their path right from the get-go, just based on, maybe where they live or what kind of job they have or where they grew up. And then the last bit of the chapter will focus a little bit more on how can we start to promote health in our community. So what are healthcare professionals doing that's working? Motivational interviewing is one strategy that works well with patients in getting them to change their poor behaviors. But what might be some difficulties for patients in maintaining healthy behaviors? And this is a great thing to consider for anyone who's going into patient care, from movement science to therapies, like PT and OT. We have just a plethora of different medical care professionals working out there. And they all play a piece. So think of it like of a puzzle. Every person plays a piece of that puzzle in helping shape a person's life into being a little bit healthier and getting it into a healthier place. And then, as well, it's not just healthcare professionals, but it's the schools, religious organizations, workplace, community that we live. All of these sort of entities play a big role in promoting and maintaining health. All right, so you have your PowerPoint slides for that chapter. Again, instructions on how to cite as you're writing, making sure that you're citing correctly in APA format. And then, as I mentioned in the beginning, this week's discussion is based on the chapter in the longevity book, chapter 6, which looks at early life experiences like breastfeeding and early education. We're talking about like daycare and preschool, and how that relates to one's health long-term and longevity long-term. You're going to be looking at some examples from the termites, of those who did and did not breastfeed, of those who started school very early or started school on time. And then when it comes to higher education, those who went on and got advanced degrees, how did that factor into their health and longevity? So I want you using lots of examples here from the readings. Here's an opportunity. You can not just tie in the longevity readings to answer these questions, but you can also tie in the main chapter, chapter 6, since it does talk about the lifespan and people's health choices over the lifespan. Right, so that wraps up Module 5, and there's one more module for this week.